So how do you know what you don't know? How do you know what your weak areas are? Well, I'm going to recommend that you take a predictor exam, not a readiness exam, a predictor exam. And APEA has the only predictor exam on the market. I do all the statistics for it. Okay. So I know about this test and I know that it's going to help you determine what you need to focus on. Now, the predictor exam, this is a sample one that I used here, but if you score 70% or better overall on your predictor exam, then you're highly likely to pass it on the first attempt, the certification exam on the first attempt. If you score between 65 and 69, you're at risk. And if you score less than 64, then you're unlikely to be successful on the certification exam. So that's going to give you some good tips. The other thing I want to point out for this one is, look, there's 150 questions on this exam. This person answered it in 2 hours and 4 minutes. So that's 124 minutes for 150 questions. They didn't even spend a minute on each of the questions. So that tells me that they may not have been reading the questions in their entirety. So this gives you an overview of what else the predictor exam tells you. If you look at these knowledge areas, in cardiovascular, this person scored 67. Well, look at dermatology. They scored 42. They need to spend some time there when they're doing their study plan, right? We also break it down even further into diagnoses. So you know the questions that you missed and what diagnosis that was. They missed a question on human bites. That was a planning question. They missed on diagnosis for herpes zoster. So that person really needs to review how to diagnose herpes zoster. So you see how this works, and that helps you to determine exactly where you need to study and exactly how much time that you need to spend when you're reviewing that particular area. So you take this information, detailed information by diagnosis, you take your day planner and you plan that out. Now look, when you're planning, it's important that you remember, okay, I'm working 12 hours this day, so I'm probably not going to spend any time studying on Wednesday because I'm working 7A to 7P. And when I get home, I'm taking a bubble bath. I'm going to take some me time. Okay, your brain needs that. But on Thursday, you're off. So you're going to make sure, look, I'm going to spend all day on cardio. And I'm going to make sure that I cover lipids and hypertension. Or maybe add another one, heart failure. Maybe heart failure needs to be on a different day, depending on how many questions you miss. You see how that planning goes? That's important to help you stay on track and making sure that you're plugging in those holes that you have in those knowledge areas. Use the clinical practice guidelines book. If you're using QBank management, then you're going to go to QBank management. You're going to tell you to give you questions in cardiovascular that day. You can do that in study mode. That's where you answer the question and then you review the rationale. And look, don't skim over those rationales. Those are the most important thing because that's where you're going to get the meat of the information. If you miss that question, why did you miss it? Do you not understand the pathophysiology of heart failure enough? And maybe you need to go back and review that. That's going to help you plug in those holes. And then test yourself. If you're testing yourself in QBank, then you need to be scoring 90% or better. So you do those over and over and over. The more you practice, the more you're going to get in a good habit of answering questions, and the more you're going to understand that information. The other thing that the predictor exam tells you is how you scored in the testing domains. So in assessment, 57, that's pretty low. We need some better foundational material in assessment for that person. Look at diagnosis, 30, that's pretty low. And how to diagnose conditions, that kind of goes back to pathophysiology. If you understand pathophysiology enough of a disease process, then you're really going to understand better how to diagnose it. So this gives you a lot more information to let you know the weak areas that you need to concentrate on. And I put these in here just to kind of show you. For assessment, you're doing subjective information and objective information. So if you were weak in assessment, those are the areas that you need to focus on for heart failure or for herpes zoster or whatever it is that you're looking at. That you need to, what's the patient's chief complaint? What's their HPI? What's their history? Those sorts of things. That's what constitutes the assessment domain. In diagnosis, differential diagnoses are going to be included in there. How to prioritize your differential diagnoses, because that's going to drive your plan, and establishing a definitive diagnosis for that patient. Planning, all things planning. Safe. Are you prescribing medications that are safe? Do you know the side effects of those medications? Are you considering the comorbidities of the patient? Educating the patient, teaching them how to take their medications or any non-pharmacological interventions. So planning is a pretty big area, right? And then evaluating the patient, determining, was your treatment plan effective? If it wasn't, what else do you need to do? When do you stop medications? When do you extend the medications if you're treating an infection that's not getting better? Those sorts of things are what are included in the evaluation domain. So with that information, you're going to take and you're going to plan like a boss, and you're going to make sure that you pass that certification exam on the first attempt.